Hello and welcome to the April version of CONECTboard, which is my opportunity to give you an update from our Trust board meeting, which was held last week. We started our board meeting this month with a patient story from one of our nurses from the community nursing team who look after children in the community. And this team are a team based at the hospital but outreach and support children with very complex needs at home wherever possible and within their school environments. And the story we heard was a difficult story to hear about a young lady who's been looked after by that team since she was very small and is now approaching 18 and needs to transition into adult services. And the community paediatric nurse was explaining the difficulty and the complexity of trying to arrange onward care arrangements for this young lady when she becomes 18, where previously she'd had all her care coordinated by the community paediatric nurse. Now the question is who will look after her and coordinate her care going forward. And it was a very interesting story to listen to in terms of the complexity of this person's needs and how those will be met in the future, involving the GP, community nurses, social services, education providers, and also the consultants from adult services and the specialties here. And it underlined all of our responsibilities to make sure wherever possible the transition for people such as this lady with complex needs are as smooth as possible from paediatric services into adult services. And it certainly gave us a lot of food for thought and some points that the board were very keen to hear back from in a few months' time as to what progress had been made. There are a couple of points I want to just highlight from my Chief Executive's report to the board this month. First of which was an update for the board on a recent visit from the Royal College of Obstetricians and Gynaecologists to our department here at the hospital. And this was a review that we'd asked the college to come and do to really look at how we could develop and take the unit forward, particularly given that in a hospital of our size and the number of births that we have in the hospital, we're actually quite a small unit for obstetrics particularly, and that in itself poses some challenges to us as an organisation. The feedback from the college was very, very positive from the reviewers who came in, and there were lots of really good things that they noticed about the unit here in Yeovil, and also, as always with these reviews, things that they thought also could be improved upon or areas we could develop. But overall it was a positive picture, and we're now just waiting for the formal written feedback from the reviewers before we take that back through our board and our governance committee. Second item I updated the board on was the previous recruitment that we'd been doing for a Director of Organisational Development and Workforce to replace our Director of HR, Mark Power, who left us a couple of months ago to go to Oxford. As many of you will know, this post was a joint post with Dorset County Hospital, and unfortunately the candidate we preferred we weren't able to secure at the end, and this has led us to re-evaluate where we are on the Director of OD and Workforce. And what we've agreed in the short term for the short term is that Dorset County will look at getting somebody in to help them on their own, and that we will look at our own department taking up the reins on the day-to-day HR work. We've got a very capable HR department in Mark Appleby and Ali Morris leading it, and also look at bringing somebody to help short term on some pieces of project work around organisational development. Absolutely leaving the door open for a future development of a joint post again with Dorset County Hospital. But given that we couldn't find the right person at this stage, we didn't feel we wanted to go out to the market again to seek another candidate, and we're going to take stock in a few months' time and see where we are and whether we need to reconsider that decision. Tim Scull, our new medical director, gave an update to the board last week, and his update particularly focused around some of the things he's noticed from being new in post, and particularly about his ambition and desire to have an active engagement and communication with our consultant body and the other doctors across the hospital. And Tim described to the board a number of the mechanisms he's going to be putting in place over the coming weeks to improve and develop the communication with the consultants, both in terms of face-to-face meetings, group meetings, one-to-one meetings, and I'm sure a number of consultants and medical staff across the Trust will be involved in that going forward. Helen, our Director of Nursing, also gave an update to the board about a number of patient safety issues that she's been working on. First of all, she updated the board on the rollout of the Vital Pack, Vital Signs Monitoring Solution, which has just been rolling out across the hospital. Thank you very much to all the staff on Ward 7A who were the guinea pigs for this and have done a sterling job in rolling out Vital Pack across the whole ward, to the point at which now they don't have any paper observation charts, everything is done electronically on the Vital Pack solution. And we'll now be rolling Vital Pack out progressively across the Trust over the coming months. Helen was also able to update on some really positive progress around some of our patient safety measures. Notably, we are now over a year since we had our last MRSA infection in the hospital, which is really, really good news. And we also achieved our target number of reduction in C. difficile cases over the past 12 months, which again is a really positive endorsement of everybody across the hospital, particularly our cleaning teams, our infection control teams and our ward teams who've done such a great job of managing the cleanliness of the environment, and people like our medical staff and our pharmacy staff for making sure our prescribing is doing what we can to try and reduce our reliance on antibiotics. Helen was also able to update on some of the progress we've made in falls and pressure ulcer reductions. Again, nationally this is a big priority area for the Department of Health, and rightly so. Here in the hospital we've got a lot of focus on that, and the clinical governance team led by Jo Howarth are working with a number of teams across the hospital to look at how we can improve and reduce further our number of falls and pressure ulcers for patients whilst they're in hospital. Helen was also able to update the board on some of the work we're doing at the moment to review our patient meals service, and we're doing a bit of work to look at how we can improve the quality of our food provision and looking at an alternative supplier for food for the patients, which we believe will offer a better quality of food and more choice, recognising that food and nutrition of our patients is a really important part of their recovery, and Helen will be communicating further across the organisation as that work goes forward. Tim Newman, our Chief Finance Officer, gave an update on our financial position to the board. I'm pleased to say that for the year ended at the end of March, we achieved our financial performance as we projected and have ended the year with a small surplus, which was in line with our expectations. I think it's really important to recognise that's a massive achievement, particularly given the financial challenges facing both ourselves and the wider NHS. So well done to everybody across the hospital for their hard work in delivering on our financial ambitions for the past year. It's going to be a very challenging year going forward, and Tim was explaining to the board the budget and planning process for this year, and there's no doubt that this year will be even more challenging than last as the financial challenge we face gets ever greater, linked particularly to the increasing demand for our services at a time when the money we're receiving for services has remained flat. So a lot of work still to do on further reducing our cost base and ensuring that we deliver on our continuous improvement projects across the hospital. Tim was also able to update on the progress that's been made to seek a strategic estates partner to come and work with us to help to develop the site. Many of you will know and have seen the work that's gone on to develop what we call the master plan, which is basically setting out the vision for the site of the hospital over the next 20 years. And we're also looking for a partner to come and work and to help us make that a reality. And the first part of this project is to look at how we can develop and improve our car parking facilities on site. And the very first stage is, as many of you will know, is the demolition of the Cheverton buildings. And that demolition is currently starting, and we anticipate the full demolition to get underway towards the end of this month and into the beginning of May. So you'll actually be able to see a visible site of a first stage towards our site master plan. Tim was also able to update on the progress that we've made in terms of the selection of a preferred supplier for the Smart Care, our electronic health record system. We're in the final stages of the procurement process now, and we'll be hopeful that we'll be able to communicate the preferred supplier within the next few weeks once the final sign-off's been agreed. And then we'll be beginning, obviously, the work to look at planning the implementation, the rollout of the electronic health record system across the hospital over the coming months and years. And as I've said many times before, this will be a massive piece of work that will touch nearly every part of the hospital, and it is very much not an IT project, but a hospital transformation project underpinned by IT. So there'll be a lot of communication going on over the next few weeks and months about how you can get involved in the rollout of the EHR, and also a thank you very much to all of the clinical staff who've been involved in the procurement process and evaluating the suppliers, which has been a really important part of the process to make sure we get a supplier that fits with what we want clinically. Finally, we had a review of the performance report at the board this month as usual, and just to say that the performance in all areas continues to be very good. Our A&E performance is strong, and we continue our very strong performance in terms of the handover time it takes from the ambulance crews to the staff in the emergency department, and we've seen an 11th successive month of continued progress towards improvement in that area, which is great news and really recognises the hard work that all staff involved in the ED, working jointly with the paramedics, have done to improve that process. Our referral to treatment times remain good, and despite some challenges in terms of increasing activity and demand, we're maintaining a good position in our waiting times, which is obviously a very good thing for our patients in terms of getting quick access to services. Our cancer times also, cancer waiting times remain very good as well, and we're meeting all of the national targets around cancer waiting times, which again reflects a good access to our services for people when they most need it. So overall, a very strong picture on performance, and thank you again to everybody across the hospital for all their hard work in making sure that we continue to deliver really strong performance, particularly at a time when we're facing ever-increasing demands on our services from the increasing activity we see through the doors, and particularly linked to our ageing demographic and population around us. So thank you all to everybody for all of your hard work. It's a very positive message to take back to the board. That was all of the key messages from the board this month. As usual, if you've got any comments or questions, please feel free to get in contact with me or email through to the communications team. And just a final reminder to everybody in the hospital that we have a Connect staff meeting, which is open to all staff once a month. The next one is on May the 7th in the Garden Restaurant, and that will be an opportunity to hear from me and other members of the senior team on key things that are going on across the hospital. So I'd really encourage you, if you're interested in what's going on, come and find out about it, come along to the session. It only lasts half an hour. It's a quick opportunity to come and catch up with what's going on across the hospital. There's a lot going on at the moment, but a lot of very good stuff also that I want to be able to communicate to people on a regular basis. So hopefully look forward to seeing many of you there. Thanks very much.